On the medial plane of the body, there is sternum anteriorly and there is vertebral column posteriorly. Sternum is a flat bone. It has three parts: manubrium, body of sternum, and xiphoid process. The quadrilateral manubrium is directed upwards and the triangular xiphoid process is directed downwards. Manubrium has two surfaces, anterior and posterior surface. Manubrium has four borders: superior border, inferior border, and two lateral borders. The anterior surface of manubrium is convex from side to side and concave from up to down. Its posterior surface is slightly concave. It has jugular notch or suprasternal notch on top. Now the superior border. The superior border is thick and rounded and marked by jugular notch or suprasternal notch, which gives attachment to interclavicular joint. On either side of jugular notch there is articular facets which attaches with clavicles and forms sternoclavicular joint, which is a saddle type of synovial joint. Now the inferior border attaches with the body of sternum and forms a secondary cartilaginous joint, which is named manubriosternal joint, which is also corresponding to T4 vertebra. The lower border, if you talk about the lower border, there is upper facet which articulates with first costal cartilage and forms first chondrosternal joint, which is a primary cartilaginous joint. The lower demifacet articulates with second costal cartilage and forms second chondrosternal joint, which is a plain type of synovial joint. Now the attachments. The anterior surface gives attachments to two muscles. On upper side there is sternal head of sternocleidomastoid, and the lower side there is pectoralis major muscles. Now the posterior attachments. On each side there is sternohyoid, which is placed close to the clavicular notch, sternothyroid, which is at the level of first costal cartilage and placed laterally. In the lower portion there is arch of aorta, and the upper portion there are three branches of arch of aorta. If I describe the three branches of arch of aorta from right to left, from right there is bronchocephalic artery, in left there is left common carotid, left subclavian artery, and all of them are overlapped by left bronchocephalic vein. Now the internal structure. Manubrium has no cavity, but it has trabeculae. Trabeculae is small plate, a thin plate of ribs, a thin plate of bones, and between there is space, and this space is called diploe. Now the clinical correlation. Well, manubrium is a preferred place for bone marrow aspiration because it is really easily accessible. Bone marrow sample is needed for hematological examination, so we need to insert a thick needle into the anterior surface of manubrium to avoid any kind of contact with the posterior surface of manubrium, because behind the posterior surface of manubrium there is arch of aorta. So if somehow we puncture the posterior surface of manubrium it will lead to a fatal hemorrhage.